Thyroid cancer is a cancer that forms in the thyroid gland. The National Cancer Institute defines the thyroid gland as an organ at the base of the throat that makes hormones that help control heart rate, blood pressure, body temperature, and weight. There are 4 main types of thyroid cancer: papillary, follicular, medullary, and anaplastic thyroid cancer. Miss Vinay was diagnosed with papillary thyroid cancer.
When did you have thyroid cancer?
I had thyroid cancer in the spring of 1976.
All right, and how did you find out that you had thyroid cancer?
I was blow drying my hair, and I felt a lump in this side of my neck, on the left side of my neck, and I went to the doctor, and that's how I found out. They did tests.
And do you remember what, like when they diagnosed you, do you remember what type they told you had?
I believe I had papillary. I cannot remember the specifics of the exact type that I had, but I believe it was papillary.
Papillary carcinoma is the most common type of thyroid cancer. It usually affects women who are nursing, pregnant, or who may become pregnant. It spreads slowly and is the least dangerous type of thyroid cancer.
And did they tell you what caused?
They did not. They, at that time, when I was a child, they were out in like shoe stores. There were x-rays you could stand on, I guess, to check out the size of your feet. And they wanted to know if I'd ever done that, but my mother could not remember that I had ever done that. So the only thing I wonder sometimes, well, 2 things. One is when I was working in college in a laboratory, unbeknownst to me, I was dealing with a carcinogen called, I think it was xylene, that the professor was having me clean glassware with, and he did not tell me that I needed to protect myself from this chemical. So I do wonder if that is a cause. And I also just recently read that girls who were given hormones when they were young, which my mother had me take because I was so tall, and she was trying to keep me from growing taller, so she had me see an endocrinologist, and they put me on hormones, female hormones. I did recently read that that can possibly be connected to thyroid cancer and breast cancer, and I've had both of those.
How did you feel when you were diagnosed with thyroid cancer?
I was very frightened. I was young, and even though they told me that, my diagnosis was really good, it was the whole word of cancer back in the 70s was very scary, and my dad had died of colon cancer, so it had very negative connotations to me. I'm very thankful now that it's been so many years and I'm doing well, and I still get tested. In fact, I'm going to the doctor in a few weeks, so after all these years, I'm still tested for my thyroid levels all the time.
Causes of thyroid cancer are a family history of cancer, radiation therapy, and exposure to carcinogens.
Did you experience any symptoms after the diagnosis?
I had been having heart palpitations where my heart was beating really, really fast, but I wasn't sure if that was from the, from having too much thyroid, or if that was just, I'd had a lot of life changes, but at times that was just anxiety.
The symptoms of thyroid cancer are cough, difficulty swallowing, enlargement of the thyroid gland, deepening or changing of the voice, neck swelling, and a thyroid lump, also known as a nodule.
Were you told of any statistics, or did you look them up?
I was told that I should be able to live a long life, and that, it would not decrease my longevity. I wasn't given any statistics, but I remember I was very young. I was only 22. I'd only been married a few months, and I was really upset and nervous about it, so I'm not sure how much I really remember. It was a long time ago.
There are over 40,000 cases of thyroid cancer, with only a little over 1,000 of these cases actually being fatal. The majority of these cases are diagnosed between the ages of 20 and 54.
What treatment did you receive?
I had my entire thyroid gland removed surgically, And then I had to stay in the hospital. Shortly after that, I went back to the hospital, and I was in isolation and had to drink radioactive iodine to, I guess, ablate all the cells that were left in my thyroid gland. And I think I was in the hospital for 3 days. They actually used a Geiger counter until I was no longer emitting a lot of radiation, and then I was left to go home.
Thyroid cancer treatments are surgery, where the entire thyroid is removed, radiation therapy, where radioactive iodine is used, chemotherapy, and a thyroid hormone after your treatment.
Your prognosis was a long life.
That's what they said, yes.
The prognosis for papillary carcinomas are usually slower growing. Most people are crude and have a normal life expectancy. Many patients who have surgery or radiation for thyroid cancer must take thyroid hormone pills for the rest of their lives.
Do you think that your diagnosis of breast cancer 11 years ago is linked to your thyroid cancer?
I do not think that they're linked. No one led me to believe that they were linked at all. You know, that any of the breast cancer doctors, none of them felt that it was linked to the thyroid. Now, I did meet with a geneticist last year, and she said that there are gene packages, so to speak, where a bunch of different diseases kind of come together, but they don't have enough knowledge yet to know exactly whether that's the case. But she, I think, indicated that she wouldn't have been surprised if that was all kind of connected. The thyroid cancer and some of my other issues, such as my hearing loss and so forth, that could all be somehow in some kind of a defect in my genes.
Of the many types of cancer, thyroid cancer is very treatable, and there is a lot of hope for all patients. There needs to be thyroid cancer awareness, though, because no cancer is a joke.